I've tried, written down the words to say. It is time. I've been waiting 5 days to explain how you make me feel inside. Baby, got it all figured out. Wanna do this right. There's no doubt in my mind. Baby, you're the one. And tonight I am going all the way. Touch my hair, it all goes away. The things I planned, the things I would say. Now I keep rambling on. I sound so cliche.
Hi guys, welcome back to Behind the Beauty. I am incredibly excited to have a dermatologist here, Dr. Shirley Chi. Hi. And we met a few weeks ago at the La Roche-Posay event. And I was like, I have to have you on the podcast.
Aw, thanks. So excited to be here.
So, do I call you Dr. Chi or?
That'd be fine.
Okay.
That'd be fine. So people remember my name when they have to look me up.
So you can look her up. I just Googled to make sure that if you look up Dr. Shirley Chi, you can find her if you are in the Pasadena area and would like a dermatologist after
Glendale.
you listen to this.
We have an office in Glendale too.
Oh, Glendale as well. And so Dr. Chi, I am just so excited, mainly because we get a perspective from a doctor's perspective on a lot of things. And I talk about sunblock a lot. And before we started filming, I was actually going like, hey, so how bad is chemical? What should I wear? And you had some really insightful things.
Yeah, so we were talking about whether a chemical sunscreen is really bad for you, because we've gotten a lot of press lately about how, you shouldn't wear any chemicals. I think chemicals in general is a bad word, especially in Southern California. Mm-hmm. But actually, if your skin is not sensitive to chemical sunscreens, it's actually not a bad thing to use, especially if you can find a sunscreen that has both a mineral blocker or a physical blocker. Those are ingredients like zinc oxide or titanium dioxide, and a chemical sunscreen. And those are the long names that you can't pronounce. But if you mix them both together, that's actually a very superior sunscreen, because the way physical sunscreens work is that they actually bounce light off. They reflect light. So zinc and titanium, they're like barriers, and they act like little mirrors, but they don't bounce the light off exactly perpendicularly. In other words, the light will sometimes bounce sideways or sometimes bounce back down into your skin. And chemical blockers, the way they work is that they actually absorb light. They're UV absorbers. So if you've got some chemical sunscreens already sitting there on the skin and some minerals that are bouncing light off, anything that is kind of left that has bounced into your skin again is then absorbed by the chemicals.
Okay, so that's a really good answer, because I think there's this huge controversy right now. No chemical.
Right. Well, we still recommend that, we meaning dermatologists, still recommend that babies under the age of 6 months do not wear sunscreen. And once you're over 6 months, you can wear sunscreen, but I still recommend the mineral sunscreens for babies. Okay. And that's just because babies have such a high body surface area to kind of inside ratio. So you don't want them to be absorbing a lot of chemicals just in case something in the future is discovered. And so far we haven't discovered anything really bad, but it's possible. We never want to say never. So I still recommend zinc or titanium for babies. But if you're an adult and you don't have a sensitivity, and now we're just saying I actually have a sunscreen sensitivity, so I personally only use mineral sunscreen, but if you don't have it, it works really well. It actually blocks the light better.
Cool. And then you're also mentioning how the SPF that we see on the packaging isn't actually the SPF that we're wearing.
Right. So the SPF number, and sometimes they even go up to 100, but I've seen 30, 50, 70. And that is when they actually do testing in the laboratory, which is based on one shot glass size full of sunscreen for the body or a quarter size for the face. Now, we all know in reality, nobody does that. Everybody just squishes some and then puts it on and squishes some more and puts it on. So your actual realistic SPF is a lot lower than what the number on the bottle says. So keep that in mind and try to get the highest one that your skin can tolerate.
Okay. That's really good points. And then what about layering? So let's say my daily moisturizer has an SPF 30 and then that's a physical, and then I want to do a chemical primer before my makeup.
Perfect. That's a great idea. So
Okay.
I would recommend for people that wear makeup, I would do a makeup primer with an SPF, and those are usually chemicals. Or you could do a makeup like a liquid foundation with an SPF. Now, liquid foundation SPF is usually chemical too. And then you can layer on top of it either a powder, which is a mineral. Powders are always mineral sunscreens. So like things that have zinc or titanium. Or you can layer another sunscreen that is a mineral if you want to do it that way.
That's really cool because now I'm like, okay, it's okay to mix and layer.
Totally. But remember that when you're mixing and layering, the total number of your sunscreen is not an addition. So people always tell me, well, my makeup has 15 and then I put on like Lubriderm moisturizer or whatever moisturizer with 15. And so I actually have 30.
No, that's not how it works.
No, the highest number is the number you're wearing.
Okay.
So 15 and 15 is 15, but maybe not even because you're not putting on that much. Maybe it's like 9 or 10, you know?
Okay. So yeah, that's like a big one I get asked a lot too. And I'm like, no, that's not how it works.
So yes. And so in general, I recommend in Southern California, pretty much all skin types, if you can burn, if you've ever had a sunburn before, you should have an SPF 30 or higher.
Cool. And my dermatologist I saw a long time ago said SPF 30 always, like minimum. So does SPF 15 do anything then?
SPF 15, once you put it on your body, it probably becomes maybe an SPF 7 or 8. It's better than nothing, but it's not enough to prevent aging or prevent sun damage in a UV area like Southern California.
Yeah.
So I don't recommend it.
Okay. That makes sense. I was like, wow, only a 7.
Kind of like the old Hawaiian tropic oil that we used to put on. Well, when I was a kid, we'd put on this oil and it just makes you burn more.
So let's backtrack a little bit. Do you mind telling the audience a little bit of your journey to becoming a dermatologist?
Oh, sure. Okay. So let's see. I always liked science. And so I was a nurse assistant in high school. I did like an ROP program. I did that and went to college. Wasn't sure because pre-med was hard and I wasn't sure I really wanted to do it. So I majored in philosophy because I thought maybe I would become a philosopher. But I realized I didn't really have that much to say to people. Philosophically, I enjoyed studying philosophy, but not really creating philosophy. So went back to my science kind of roots and did the pre-med curriculum. Went to med school thinking, because I had worked, during this time I had done research in political science, a feminist politician, and I worked in a women's center in college. And so I thought, I'm going to do women's health. So I went to med school thinking, I'm going to do maybe OB, breast cancer. So I did a bunch of breast cancer research. And then when I did my OB rotation, which is where you catch babies, I realized I don't think I want to catch babies my whole life. I mean, it's for some people.
Yeah.
So then I kind of wandered through the wilderness going, what am I doing? I want to do women's health, but I don't know how to make that fit in with, a lifestyle and a specialty that I enjoy. And I just happened to do a dermatology rotation at that point, and I just fell in love with it.
Oh, wow.
And I just kind of realized, hey, this is so great. You get to treat people that are babies. You get to treat people that are 100 years old and everybody in between and their family members. You are with them for their life, so it's not just like you see them once and then you never see them again. And you really become like an integral part of their care team. And people care about their skin because it's on the external side.
Yeah.
So it's not like, okay, I've got diabetes and my doctor's trying to convince me to take care of my diabetes, but I can't feel it or see it. People know if something's on your skin, I got to take care of it because this is what people are seeing. So I feel like our patients are highly motivated to be partners in their own care. So I love it. It's awesome. It's like the perfect kinds of patients. It's the perfect specialty for me.
That's awesome.
Yeah, but it was definitely a roundabout
No,
way
but I
of
think that's
getting
the
there.
best because you really know this is something you want to do. It wasn't like, okay, I just picked this out of a hat.
No, you have to really, and I think that's for any career, you have to kind of really get down to who you are as a core person, what motivates you, you know, do you want to work with people or do you want to just kind of work behind a computer? That's true for some people. I knew I was a people person, obviously.
No,
kind of
that's
chatty.
great. And no, it's so good to find a doctor that actually wants to talk.
Oh yeah, I talk too much. You should ask my staff. They're like knocking on my door. It's time to leave.
Next patient.
Yes, there are people waiting. Yeah, so apologize if you come to my office and you wait a few minutes because that's just me talking.
No, but I think it's good to not feel rushed as a patient. And that's the thing. It's very hard to find a doctor that you want to trust and that you want to look at you that closely too.
Yeah, and I think you do have to sort of have an artful eye too. I think in dermatology, because we do both medical and cosmetic things, you have to be able to have your foot in two different boats. You know, you have to be able to look at a person that could have melanoma and be able to, you know, deliver that kind of bad news to them. But at the same time, you have to look at somebody who is aging and wants to look their best and take that concern really seriously. And some people don't, you know, some other specialties maybe wouldn't. But in my field, I feel like everybody's concern is valid. And, you know, we want people to feel their best.
Yeah.
That's part of our specialty.
It's really cool because you're not just helping, hopefully saving lives by diagnosing melanoma early and being able to treat it, hopefully, and spreading the skin health. Like,
Yeah,
because you had said something that really touched me when I saw was when I first met you was that melanoma and skin cancer is the only cancer we can see.
That's right. It's the only cancer that grows on the external part of your body. So if you get it and you notice it, that's the cure right there. There's no other cure other than catching it early.
Yeah.
Once it goes beyond a certain level, your prognosis goes way down. But if you catch it at an early stage, it's very curable.
And we can do something by screening ourselves, paying attention.
So once a month, I tell people to look at themselves naked. So you're supposed to be doing a self-breast exam once a month, ladies. I know we forget, but at that point, it would be a good time to just kind of go to a full-length mirror and look at yourself naked. And you're looking for something that stands out. So people are always like showing me 100 moles going, well, what about this one? What about this one? What about this one? And that's not the way to go about it. What I tell patients is you want to look for the ugly duckling, the one that doesn't look like the rest. That one is going to be the one that has the highest risk of changing or becoming a melanoma, because the chances are that your 100 freckles that all look the same, they're not all going to become melanoma. But the one that has a little red in it, or it's turning black, or it's raising up and the others aren't, that's the one to bring to the attention of your dermatologist.
Okay. That's my biggest question because I'm very freckly and very moldy.
Moldy. You're not moldy, we hope.
Moldy. And I think part of it's genetics and the other, and probably just my skin type.
For sure.
And I see them popping up as I get older, but I don't think they're all cancerous.
No. And that's another thing. We will get more moles until we're about 40-ish. You also get more moles when you're pregnant.
Oh, great.
I know.
You're selling me on this pregnancy.
Sounding great, isn't it, ladies? But when you're in your 50s and 60s, those moles then regress.
Okay.
So you'll get more in your kind of teens all the way into your 30s, and then you get less once you're in your 50s and 60s. But melanoma also happens in those times. So melanoma has two peaks. of age. And one of them is the young group. And that's people that are in their teens all the way into their 40s. And then the next group is the people who've had a lot of sun exposure in their lives. And those are the people in their 60s and 70s and above. The younger group melanomas tend to be hereditary and they tend to be more aggressive. So that's why we really want to be careful of our younger patients, because that's a lot of years lost if you don't survive melanoma.
Yeah.
So please, no indoor tanning. Now that's now illegal in the state of California to be under 18 and to indoor tan. That's a new law.
Oh, wow.
Which is great. California really led the way on this legislation. Kind of like we lead the way on a lot of legislation. but indoor tanning is now illegal in California if you're under 18. And that is because you can do so much damage at that young age. Young people and children are especially susceptible to the effects of radiation. And so the UV radiation is a form of radiation. So if you can just get into your 20s, when you also know more about the effect of UV damage, you can make that decision for yourself. But I recommend no indoor tanning.
Okay. Like, when honestly, there really shouldn't, in my opinion, there shouldn't be any more of those UV beds or indoor tanning beds.
Oh, there are lots.
There's a ton. And people buy monthly like packages for it. But I really say, you know, if you want to look tan, do the fake tan, do the spray.
For sure, the fake tan. Now there's so many different kinds of self-applied fake tanners. They look pretty good. The best ones have antioxidants in them, like vitamin E. Kind of keeps it from looking orange.
Yeah.
But there's a lot of brands out there, and they do a good job. And you can also do the custom tan right before a big event. It lasts about a week.
Yeah. I mean, I only self-tan, and then I sit under the shade with SPF 100.
I do that too. I self-tan, you know, and sometimes I do it in the morning before. If I'm wearing a skirt, I'll rub it on my legs really quick because nobody likes white legs.
That's the thing. And I will tan. I can go pasty everywhere else. It's just my legs that I'm always like, let me rub something on there.
Right?
Yeah. And that, I used to never wear SPF on my legs.
Oh, yeah, that's not good.
Yeah, because I wanted it to get tan.
Yeah, and we see a lot of patients. Now, this doesn't usually happen until you're in your 50s, but, you know, we're all going to be in our 50s hopefully someday. And you start seeing these little crusty growths on people's legs in their 50s and 60s, and those are precancerous, and it's from not wearing sunscreen on your legs.
Great.
I know, something to look forward to.
Yay, we get to find out if all of those years of laying out.
I know. And then unfortunately, nothing really treats the legs very well. I mean, we can do chemical peels on your face and your neck, and we could do laser, but for some reason your legs don't respond well to those treatments, probably because our blood circulation is not great in our lower extremities. And so nothing heals that well on the lower extremities.
Okay.
So I can do like heavy peels, I can do lasers, I can do a lot on the face to make those spots go away, but I can't do much on the legs.
Okay.
Yeah.
That's good to know.
Watch the legs.
There's like a weird growth I've had on my ankle, and I had it removed by my previous dermatologist a few years ago, but then it's grown back, and she didn't think it was cancerous, but now I'm just like, what is this thing? I have to make an appointment with you.
You'll have to, and bring your little your result sheet from last time.
I'll have to find it. I'll have to ask for it somewhere.
They have it.
I'm sure they still have it.
Yeah,
they have to, right?
They have to keep it for 7 to 10 years, depending on the area.
Okay.
Yeah.
So yeah, there's like weird things starting to show up on my legs. Nothing scary just yet, but I'm just like, okay, I need to wear sunblock everywhere. So for every single day, I always do my face, but I don't really remember to do everywhere else.
Yeah. You know, I tell patients to really focus on their face and neck. You should be wearing sunscreen on your neck every day.
I just now am actually applying a whole dollop of it, but before I would just drag everything down.
No, you want to, dragging down is never a good motion. First of all, we always like to apply upward. Remember, ladies, upward motion. But you want to put the sunscreen separately on your neck. You want to make sure your neck gets its own sunscreen. And then I tell people to put it on their arms and hands. It's hard though, because you're going to wash your hands, but still, even if you just put it on the backs of your hands and then you drive 30 minutes to work, that still protects you from that much UV. Because remember, the sunlight that comes through your car window, the windshield doesn't protect you from all the UV rays. It protects you from sun, but not all of them.
Yeah.
So you can't, if you sit in your car the whole day, you won't get as bad of a sunburn as if you just was outside, but you'll still get a burn eventually, and you're going to still get all the UVA damage, which causes skin cancer and aging.
Great.
So you can't just, something I hear commonly is people will say, well, I'm not in the sun. I just make a 45-minute commute back and forth. That's 1.5 hours of unprotected sun exposure every day.
Yeah. And I even say, like, if you go get the mail or if you walk your dogs, like,
I just tell people, rain or shine, if you live in SoCal, put on your sunscreen on your face and neck. Get used to it.
mm-hmm. I'm going to make sure I do the neck now. I used to just drag whatever was on my face down, but we really should be taking care of this area.
Yeah, because, we do a pretty good job of anti-aging on our face, but then eventually our neck kind of exposes our true age. So we don't want that.
So you do preventative, you do treatments for any issues like rosacea, acne, and you also do cosmetic things to kind of help. You talk about lasers and peels. What are some of the lasers and peels you do?
So we do lasers and peels for all different skin types. We are in an area where we have every skin type under the sun. So you have to be kind of careful about what kinds of treatments you're offering to people of different skin types, because not everybody can do every single kind of laser or peel. But we do lasers for dark spots, blood vessels, like for rosacea. We do anti-aging lasers, so fine lines, wrinkling around the eyes, around the mouth. We do chemical peels for all those reasons mentioned. Some people like chemical peels better because peels are less expensive, and then they provide a very good treatment result. Although you do have to have like a week of downtime. So you kind of have to pay for it either way. But if chemical peels will run, $150, $200, whereas a laser treatment for your full face, you're talking $500, like right off the bat. Mm-hmm. So, you definitely save money, you get more value out of the chemical peel. So that's why people choose that. We do a lot of acne treatments. So we have acne lasers, we have acne peels. So those are sort of the light and peel section that we do. And then the other part of anti-aging is like filling and Botox. And so we do a lot of that too.
Have you used any of the fillers yourself?
Oh, yeah.
Are you serious?
I
oh my God.
do. I know. So does that look like it?
No, I need to come to you then, because my biggest fear is looking crazy.
Right. Well, and I'm not wearing any makeup today, so you can tell that this is how I look.
And I've seen a lot of women who get fillers and Botox without makeup, and you can tell that they got fillers and Botox.
Right. So one of the best fillers for younger people, because I'm going to put you in that category. If you're going to ever get fillers in the next like 5 or 10 years, you're going to be one of the younger people that get fillers, is the collagen stimulator, which is called Sculptra.
Okay.
That is not a traditional filler. It's not like a bunch of collagen that you're just squishing into one place. It is a stimulator of your own body's collagen. So I have that in my face because, I started in my 30s, and I did it because I wanted my patients to see that I could do it, and also to know what my patients go through.
Yeah, I want to know how painful it is, and if you've done it,
yeah,
you can
so I
tell
know.
me.
Yeah, and I also know the feeling of when you're doing it. Oh my gosh, what am I doing? Am I making a mistake? Am I going to damage myself and hate myself for just being vain? So, but it's a great filler if done by the right doctor.
Okay.
So it's very important to see the right dermatologist. To have a board certified dermatologist. In some cases, plastic surgeons are good at this too. Although surgeons, they often want to do surgery. So just know that going in there, like if you're not a surgery person, you may not want to see a plastic surgeon right off the bat. You might want to see a dermatologist first and let them suggest surgery, because they can always refer you.
Whatever you have. No, seriously, because you have beautiful skin. She's not wearing any makeup, so if you guys want to see what no makeup looks like,
oh, this is what it looks like, people.
You go check out the YouTube video if you're listening on the podcast. But
I'm doing my Alicia Keys impression today.
But man,
yeah, well, so you want to really stay with especially the younger crowd. You really want to stay with like a natural looking filler. Mm-hmm. So I think Sculptra is a great filler because it's your own stuff. It's your own collagen that's growing, so it's going to look really natural. It's going to move with your muscles, right? As opposed,
so excited.
you're so excited. And as opposed to some of the ones that we use on older patients where they really just need a lot of structure and volume. And so they're less concerned about movement. Younger skin, you want to maintain that supple appearance, right? You want to look kind of dewy and, nubile. You don't want to look stiff.
And that plastic sheen that Botox can give.
Right. So here's the thing about Botox. There's nothing like Botox. I mean, there's other brands now of Botox-like products that are all pretty good, actually. Dysport or Dysport is one of them. Xeamine is one of them. They are all similar to Botox. And what they do is they relax your muscles. So you don't want to use too much. And I think the error that we've made in the past, maybe 20 years or so, is that we've been putting in too much Botox and just like freezing people out. And I never understand, like whenever I get a celebrity client, I never get why they want so much Botox. I'm like, wait, you're an actor, right?
You can't move your face
You
now.
have to emote. Why are you getting rid of your ability to do that? But, I mean, sometimes they just want to do it for like press coverage and just looking good in pictures. But what we're really going towards now is the natural face.
Yeah.
The natural face can move. I have some Botox in my face right now, but I'm still able to raise my eyebrows. I can still like look mean or look happy or, like I still want to look. What you're trying to do is just maintain your natural appearance, but make the aging process a little bit more palatable. So we want to age gracefully. We're not trying to look like we're 18 years old.
Yeah. That's never going to happen.
Well, and you don't want to look like you're 18 when you're 45.
No, it just looks weird also.
It does. And you want to look, like the best person that you could look like, for your age bracket. I mean, I wouldn't mind, I'm 41 this year and I wouldn't mind looking like I'm 34 or 33, but I don't really want to look like I'm 18.
No, yeah.
So that's the idea. The new wave is going towards a natural face, and that we can do it with Botox. We have to really be careful about the amount that you're doing. Do not overdo Botox.
I am totally making an appointment.
You don't even need any. I'm not even going to go into this. You don't need
No, okay, here's my thing, and I don't know if it's even fixable, but genetically and age-wise, I've noticed in my family, especially females, we get this this loose jowl, and it's not as noticeable in real life when I'm talking, but it's one of those things that is very noticeable on camera, in photos.
Oh, okay.
And I would love to
You can help that. We can do that.
Just gracefully. It's gonna happen, I know.
Yeah,
But
why? But yes, why not slow that down as much as possible?
Yes.
We still want people to look like themselves. So what I often do is I have people bring in pictures from 10 years ago or 20 years ago, depending on their age. I mean, if you're 40, I'm gonna want to see you when you're 30. But if you're 60, I want to see you when you're like 40.
Yeah.
So that I can match that appearance. I'm going towards that look, and I can usually even tell without a picture, what will make somebody look better. And this is where the art and science come into play. You need to be somewhat artistic, because you're creating something on this person's face that they're going to need to be happy with.
Yeah.
So you're sort of like a sculptor.
And how painful are these treatments?
They are a little bit painful. I'm not going to lie.
Yeah.
But you know what I always tell people is beauty is pain. It's a little bit
when
painful.
you say a little painful, so I had, which didn't really work, but where they took this electro zappy thingy to try and
probably
zap away some of the freckling.
Okay.
That's pretty painful.
Did they put a topical numbing cream on you first? So we do a lot of anesthesia. I mean, anesthesia is huge. I mean, we do topical anesthesia, which is a cream. We let you sit with it for 15 or 20 minutes. You can take oral pain medicines if you feel like you need it or something to help with the anxiety. We actually serve wine in our office. We started doing that because it was our 10th anniversary. And so we started just drink wine, and we started doing it in the afternoons, and people were like, well, I have a morning appointment. Why can't I get wine? And so then we just started doing it. And that helps. You know what? A little bit of wine. Anyway.
Just takes the edge off.
Just takes the edge off. And then we also do numbing shots. So if you're doing a deep filler, like Sculptra, which we're placing, deep in your skin to grow collagen where collagen used to be. We do actually mix it with lidocaine, which is an anesthetic that dentists use to just calm it down so that you're not, really in pain. So
Okay.
the first couple of shots are uncomfortable, but then it becomes, tolerable after that. And I've never had anybody stop their treatments because of pain.
Well, that'd be weird too. I would just muscle through at that point.
Well, we have a lot of men too. And I
Okay.
always feel like men, I mean, no
that-
offense, men.
Yeah.
But I feel like women can tolerate pain a little bit better. And we've never had any men stop.
Okay.
So I think it's tolerable.
It's tolerable.
Yeah.
It is not comfortable, but it's tolerable.
It's not comfortable for sure. So you can't, so I don't want to make people feel like this is going to be like a walk in the park.
Yeah.
But it's definitely, and it depends on the thing. Botox is completely tolerable. For
Okay.
some people, they don't even feel it.
Really?
Some people don't feel Botox going in.
Okay.
The deeper fillers, like the Restylane, the lip fillers, the collagen stimulator that I talked about.
The one I want.
The one that you want. Yeah, those are a little bit more uncomfortable because we're going deeper. But again, they're tolerable. You can do it.
Okay.
Yeah.
I mean, I totally want to do it, and I want to film it. Like I want to.
Okay.
No, because I always want people to know. I think it's important for
Yeah.
people to know if they're curious.
Yeah, that's true. I mean, if you're comfortable.
I film my extractions.
Oh my God.
Yeah, I show people everything.
She's the next pimple popper doctor.
No, I'm not no, you guys are the professionals. I just take everybody along for the ride.
Were you there when they were asking me why I don't film my pimple popping? Oh no, you weren't at the table.
No, but you told me, and I was all
yeah.
like, well, yeah, that makes sense.
Yeah, like I don't, not everybody enjoys just like popping pimples.
Yeah.
I really enjoy doing the sort of the artistic part
the
of it.
sculpting.
Yes, the making people happy with the way they're aging. I really enjoy that part because I feel like I can put a lot of my own technique into it, and that you can't really. That's a technique that I've honed.
Yeah.
And I feel like I'm really good at it, so I don't feel like it's something that you can kind of go anywhere for. Whereas I think popping a pimple is more standard.
Yeah. I think people just get so grossed out by watching it, and it's addicting.
Oh, that's what it is.
It really is, because I watch extraction videos for 3 hours straight. Not for any of it was the same thing. I just kept watching it, and I don't know why.
Oh my gosh. See, you need to have a baby.
So for any of these, what's the downtime?
Okay, that's a good question. For something like Botox, usually you don't bruise. There is sometimes a little bit of bruising with Botox, especially if you're drinking a lot of alcohol, in the days leading up to it, or you're taking a blood thinner. If you get a bruise, it lasts about a week. You can cover it with makeup, but sometimes it's not totally coverable with makeup.
Yeah,
so
I
you
see a
gotta be
lot
little
of women with bruising.
careful.
No, I'll
be
walk
careful
around
with
Beverly Hills and I'm like, oh, you just got Botox.
Yeah, or a nose job.
Or a nose job. But it's usually I can see it around here and
Yes,
stuff.
yes. So that's the filler bruising. So
Yeah.
if you get the filler, like the Restylanes or the Sculptras, if you usually do get a bruise because those are deeper injections, and again they last about a week. You can take medicine to prevent bruising, arnica, which is sold at Whole Foods and other retailers, and you can cover it with makeup. And there's also a laser that can kind of break up the bruising, but it goes away.
Yeah.
The other side effects, besides just a little bit of discomfort, if you do it with the wrong person, if you're doing it not with a board certified dermatologist. Now I hear about people doing things at parties at their friends' houses or med spa events or something. You got to be
Who's
really careful.
doing it?
Yeah, you just don't know. I would be very careful about those kinds of promotions.
Okay.
You don't know if it's a nurse or a high school grad, or you don't know, so I would definitely, you only have one face.
Yeah.
Okay. So just spend the money so that you're going to be happy with it. I know people do it to save money, but it's not worth that money.
It's your face.
I have seen a lot of botched jobs. So you got to be careful, and by botched job, I don't just mean it looks bad. I mean that people can become necrotic. Like if you inject it into a blood vessel, you could become gangrenous. It can be really bad. I've seen that in the lip. I've seen it in the nose. I have read about injections near the eye that have caused blindness. So you have to be careful about who's doing it. They have to know their facial anatomy, and they have to be board certified.
Oh my God.
So board certified dermatologists or plastic surgeons only, please.
Oh, wow. Yeah. I just feel like that's almost like, yes, why would you ever?
Because it's cheaper to get it done. You know, it's very tempting, you know, when you flip through like the quarterly Pasadena or whatever magazine, you know, to say, oh, wow, they're offering this at this med spa for like 25% cheaper than at my dermatologist's office. Well, you know, you really need to pay for that expertise.
Yeah.
I would not recommend, and I'm not just saying that because I'm trying to get you to come in, you know, or anything. I wanted, I'm saying it for safety.
Yeah,
If you were my sister, I would not want you to go to a med spa for your treatment.
Okay. Oh, wow. Yeah. That just like creeped me
I mean,
out.
med spas have their place, you know?
Yeah,
You know,
I
if you want to
mean-
do hair removal, if you want to do like, they do tattoo removal, they do facials, they do massages. There's a lot of stuff that they do, you know? And I send people to med spas for, if you're like a tanner skin person, you can't do laser hair removal and you have to do, what's that thing that they, it's like a zappy thing. I don't remember the name of it now. Anyway, it's a hair removal kind of electrical thing.
Oh. I don't know what it's called, but it's like a radio electric frequency, right?
Yes, but it's for hair removal. Electrolysis.
Okay.
Yeah, electrolysis. Remember that old thing? Some people have to do electrolysis. So I send them to the med spa. Tattoo makeup. I don't do tattoo makeup. You know, the esthetician does it at the med spa. But there's a lot of things that the med spa should not be doing.
Which would be fillers and
Fillers, you know, like removing. Actually, I think even I just heard that there's a law that passed that med spas are not allowed to pop pimples. They're not allowed to do that anymore. They're not allowed to pop cysts on your face, milia, which are like tiny little cysts, because of an increased risk of the resistant bacteria staph, the resistant staph that's coming up.
yeah.
There have been some lawsuits, and so they're not allowed to do it anymore.
Wow. So speaking of like random things you shouldn't do at the wrong places, there's a lot of DIY skin treatments going around.
Yes, I just had a patient that did derma blading. Have you heard of derma blading?
Isn't that where they like scrape with almost like a razor?
Yes, she was, and so she was given it as a gift by her friend, who is an esthetician, and the friend just said, "You just got to do it yourself." And she came into my office with an infection, pimples all over her face, and she has really tan skin. She's a darker skin, Hispanic, young woman, really, really beautiful woman. And it was awful. We actually had to put her on antibiotics. We had to, we're going to be doing a number of chemical peels on her to help with the scarring. There's a lot of things. Yeah, there's scarring because she actually cut her skin with these razor blades. This is called dermaplaning or
Okay,
something.
so I've seen this on YouTube.
Right.
Some of the like Tweezerman is selling it. They are giving it to beauty bloggers like me. I got it in the mail. I'm not. I was like looking at it. I'm like, this is really sharp. It should not. I should not be responsible for my face.
No, I would not do that. I have seen some bad actors after that.
Yeah.
Don't do that.
And you might get away with it like a couple times, but honestly, guys, like anything that's cutting, scraping,
Anything that breaks the surface of the skin, you know, beyond like just the comedone extractor. And there is a right way to pop a pimple.
Yeah.
You know, if you know the right way, you could do that yourself. Beyond that, I wouldn't do it. I would get a professional opinion.
yeah. It's just not worth it.
Well, I've just seen too many things, and it can cause scarring. The problem with it is that, you know, it's not just the infection, which already is scary enough, but it's scarring. Scarring lasts forever.
Yeah. And just because you see it on like someone doing it at home on YouTube doesn't mean you should do it. Just because they managed to get away with it doesn't mean you will.
Right.
And then the other thing, microneedling was really popular. I even
Okay.
jumped on board on that.
Right. So the Derma Roller, which is the rolling version of the microneedling, I actually like it. I always recommend that people use the smallest size needle that they can find. And I think that's 0.5 millimeter. That's the smallest one. You can start with that. And it doesn't it penetrates the skin, but it's so small that it doesn't cause any bleeding or anything.
Yeah,
it shouldn't
mine
be
was-
shouldn't be causing bleeding.
Yeah. And plus I'm doing it to myself. It's not gonna, I'm only gonna do it so
Right,
hard.
so don't do it too harshly. But what I do is I actually order them for my patients, so I know they get the right one, and then I teach them how to use it.
Okay.
And then right after you use it is the best time to apply like anti-aging medicines or lightening serums or antioxidant serums, because then it penetrates better because you've created these tiny little pores, like channels on your skin that will absorb better. But I would just stick with the most minimal thing. And I do not recommend breaking your skin. If you're using one that's causing like redness or bleeding, you got to stop.
Okay. So that one's actually an okay one.
Yes.
And then what about these like DIY treatments using organic fruit and like ingredients at home?
Okay. So some of it is okay. I just did an article in Women's Health where we talked about yogurt. So this is a big trend in France where people put Greek yogurt mixed with honey on their face. Now, honey is a natural antibiotic. Yogurt has probiotics in it, and we're starting to find out more and more that probiotics are good for your skin. They kind of create a flora that's a natural environment that decreases inflammation, is good for rosacea, decreases sensitivity, and all that good stuff. So that's okay. Put as much yogurt on your face as you want to. Anything that causes burning, like people put lemon on their face.
That's a big one. Lemon.
Yeah, I do not recommend lemon on your face.
Well, also, isn't it? It's an acid.
It's an acid. It also can cause an allergic reaction that leads to scarring.
Okay.
It's called the photodermatitis in medical terms. And we see it in people who go to Mexico and drink a lot of tequila, and they spill lime all over themselves, and then they get this rash that looks like,
Oh my God.
streaks of lime that drip down their body. And then they get this, and it lasts for like 10 years. So I don't like lemon or lime or anything caustic or acidic on your face.
Okay.
But, if you want to do like cucumber, put it in the fridge and then put it on your face, that's fine.
Okay.
That's really popular in kind of Korean spas and things like that, the cucumber.
Yeah.
That's calming. That's okay.
So anything that's calming and nourishing, no acidics, no.
I wouldn't do anything acidic, but the calming, nourishing, yeah, and green tea, that's calming. So you could do that. If you can put those things in the refrigerator and then put it on your face, that's fine.
Okay.
And so, but I don't have a list of every single caustic thing that people put on their face, because people put a lot of stuff on their face.
Yeah, they're doing like this. They do the Elmer's glue and activated charcoal mix.
Okay. Can you hear that sigh?
Yeah.
I don't like glue on the face. Glue can be very allergenic. So it depends on the kind of glue, but anything that has acrylics in it, acrylics are also found in nail polish. They can cause allergies. So don't do that. Charcoal, I've seen that I've seen sort of kind of tubs of charcoal from Mexico or things like that, and people mix it with apple cider vinegar, or people mix it, with aloe vera and put that on their face. That's fine.
Okay.
Just wash it off. Wash it off, but it doesn't really do that much, but at least it's not harmful.
Yeah.
Aloe is good for your skin.
Yeah.
So if you want to put anything in aloe, that's fine. In fact, I did this piece on Channel 7 News one time where I made a little scrub, because I don't really recommend microbeads for environmental purposes,
Yeah.
really. These microbeads are now getting into our water supply.
Well, it's illegal now.
Oh, yes, that's
Yeah,
right.
yeah.
So they don't do that. But people still have them. And people are always telling me, oh, I just scrub my face with these beads. I'm like, no, don't do that. So, but instead of that, you can do baking soda with aloe vera and just make it into a paste and use that kind of as an exfoliator, and that kind of sucks out the impurities. And then the aloe is also moisturizing, and you can wash that off, and that's good for your skin.
Okay. Not on the face though, right?
No, you can do it on your face.
You can?
Yeah.
Okay.
Yeah, it's
I
just
was-
a baking soda.
I was told never to put baking soda on my face anymore.
No, you can do that.
Okay.
I mean, you're not leaving it as a mask. You're using it as a scrub.
Okay.
So it's just like gonna absorb, and then you just rinse it off.
Okay, I'm gonna have to try that one.
Yeah, it's good. It feels good.
So before we run out of time, I want to get some of the questions that people sent in from Facebook.
Okay.
Some might not be answerable just because, you know, you're not sitting in front of them. But I got a question, will retinoid cream clear up my dark spots and adult acne?
So retinoids are vitamin A derivatives, and they come in creams and gels. They are for acne. They prevent acne. They're good for whiteheads and blackheads, and they also reduce skin cancer risk. So I really like retinoids if you can handle them, because some people are sensitive to sort of the drying effects of retinoids. If you use it long enough, it does help with dark spots. You have to use a sunscreen with it because retinoids make your skin a little bit thinner. So if you're not using a sunscreen, it will just make it so that you're more prone to more sun damage. But if you keep using it, it does break up pigment. So it helps with scarring of acne.
Cool. And this is something you get from a dermatologist, correct?
Yes, this is a prescription-only medicine. You can get it probably from your primary care doctor too, because it's pretty safe.
Okay. So, and then the next one, menopause acne is a real thing. And now that I'm in it, I realize it's true. I have more breakouts now than I had in my 30 years. The thing is, my skin is on the dry side and delicate already. I cannot use harsh cleansers because they will enhance my dry skin. I drink plenty of water daily too. Does she have any advice for menopausal women who are having breakouts? Is there something you recommend?
I would probably see a dermatologist, because there are medications that we use to control how your skin is reacting to your hormone changes, but they're prescription and everybody's different whether they are a candidate or not. So she should see her dermatologist. But yes, there is a treatment for that.
That's good to know that there is a treatment.
Yes.
I'd love to know what I can do to reduce the appearance of, I don't know what SF stands for, and clogged pores, and if there's anything that I can do about my frown lines and smile lines because they make me so sad. Thank you.
SF.
Appearance of SF. Saggy face? Oh, okay. That makes sense.
Are we just guessing?
Yeah, well, because she's also upset about her frown lines and her smile lines.
So we just went over all the fillers that you can do, and that we're really going at it with the natural face approach. So see a board certified dermatologist who who has something on their website about doing cosmetics, because you don't want to see somebody who only does skin cancer, for instance.
Yeah.
But that's probably the answer for that. And then the other part was
clogged pores.
Oh, clogged pores. So retinoids are great for clogged pores. You can use retinoid cream at nighttime, and again, you're decreasing your risk for skin cancer and treating wrinkles at the same time. That's one. You could do microdermabrasion. There's something called the silk peel, which is, I call it like a steam cleaner for the face. So we have it in our office. Lots of dermatologists have it. It's like a device where you have like a diamond tip microdermabrator, but at the same time, it's putting in a medicine to clear your skin, and it's sucking it out at the same time.
Oh.
So that's why I call it a steam cleaner, because it's like churning all this water and it sucks all your pores out. Yeah, it's great.
And here's the thing. This is why I always stress on my channel, wear SPF, prevent aging as much as you can, because it's going to be very expensive to fix it later.
Correct. Prevention is really the key.
Yeah, because once the lines are there.
Yeah, and if you wait too long to treat them, this is why, it's always good to start maintaining. If you're thinking about maybe doing Botox or maybe just do it, because the later that you go, the harder it is to turn that back.
Yeah.
Once it's set in stone, it's kind of set.
Yeah, and why SPF is so important, because that prevents the wrinkles.
Prevents the wrinkles in the first place.
Yeah, and there isn't like a magical cream that's just going to make it go away.
No, actually, they are working on a topical Botox.
Oh.
So that's something that's in the works.
But right now there isn't.
But maybe like next year there will be.
Isn't that
amazing?
Yeah.
It's a good time to be aging.
And then the pores thing, that's why if it's really clogged, you need to go and get it taken care of.
Correct.
Don't try to do it yourself.
I wouldn't.
Yeah.
I would talk to your dermatologist about the best way to do it.
I actually, before I knew better, I broke capillaries. Like all the broken capillaries is because of self-extractions.
Self-inflicted damage. Yep.
Okay, so I don't know if this is an answerable question, but about combination to oily skin, acne skin, which which skincare steps should she follow, and which moisturizers fit the best for combination oily skin? Can you recommend affordable products?
So, combination oily acne prone skin usually means that your T-zone is oily and your cheeks and like around your mouth and around your eyes are dry. So what I would recommend is gentle skincare products, moisturizer in the areas that you're dry. So around your eyes, cheeks, around your mouth, but not in your T-zone. So you don't need moisturizer in your T-zone if those areas get greasy. You also could use a toner, but only in your T-zone. Does that make sense? So now you're toning down the oily areas and moisturizing and like kind of giving the dry areas extra moisture.
Mm-hmm.
And then you probably need a kind of a mattifier throughout the day. You can do a mattifying primer, or you can do like those papers that absorb oil just in your T-zone during the day.
Are there any drugstore brands that you really like?
I love La Roche-Posay.
Yeah,
I really think, it's kind of one of the higher end drugstore brands. They are the level of a department store brand, but they're in drugstores. And they spend all their money basically putting together products, working in a lab. All their products are made in France. And if you look at their ingredient list, it's very simple. Mm-hmm. There's not very many ingredients in all of their stuff, which I like. I like Cetaphil. Just the basic Cetaphil. That's a good cleanser and moisturizer. Let's see. I like some of the Neutrogena sunscreens. So I think every brand has some things that I like. But if you had to pick one brand where across the board I'm comfortable with the whole brand, it's going to be La Roche-Posay.
Yeah, and I've found great results when I use their stuff too.
Yeah,
so.
They really are very well regarded. They're actually the #1 skincare line in Europe.
Oh.
They're just not that well known here.
Yeah, I when I went to Paris, I stocked up.
Yeah,
because they have so much more.
They have so much more. Actually, they're bringing in makeup. Well, you know that. They're bringing in makeup. Yes, they're getting bigger here, but they're still one of the smaller brands.
But they're very good and they're available. You can buy them on the website.
On the website or CVS, Target. They carry them. More and more they're getting carried at drugstores.
Yeah. Okay, so the next one is the order to use skincare products. Like, should we use water-based, silicone-based, and oils? Which goes first? Does it change its effectiveness? And how does it explain pilling?
Pilling?
Pilling.
Pill.
Yeah, so I think it's sometimes when you wear a lot of silicone products.
Oh yeah, then it starts like getting like little beads on your face.
Yeah.
Okay, so the order of skincare products after you wash your face should be serums. If you're gonna do a serums go first. Okay, and then your moisturizer, sunscreen, and then all your makeup.
And does it matter what serum it is? Like if it's oil or if it's...
Well, serum technically is water-based.
Okay.
Okay. An oil is not a serum anymore.
Okay.
That's like the chemical definition. But if you're going to use something oily, do that at night.
Okay.
Okay. So it doesn't like get your makeup sliding off. Silicone, if you're going to do silicone-based primers or makeup, that's fine. I like it. But try to just do one. Don't do a makeup primer with silicone and then makeup with silicone. That's too many layers because then it starts to do that pilling thing.
Okay, and that makes sense because the primer's always kind of got a silicone.
That's right. So then that's enough.
Yeah. Because that's when you don't notice it until you put that foundation on and you're like, oh no, why is it doing that?
Staying on, right? Because it's all sliding off.
That's a really good question too. The best way to get rid of acne scars, I think you already kind of mentioned this, basically retinoids. What about very dry skin? Do you have any recommendations for very dry skin?
On the face?
Yeah.
I like moisturizers that have ceramides in them. Ceramides, which is CERAMIDES.
CeraVe?
Yes. So CeraVe is great. If you've got really dry skin, don't get La Mer. Okay, so everybody wants to get La Mer because it's like $300. and then patients come in, they're like, oh my God, I spent $300 on this cream. I don't feel any better. I know. So ceramides is what you're missing if your skin is really dry. This is especially true for people who are taking cholesterol medicines, so like statins.
Okay.
Because statins are decreasing cholesterol in your whole body, including your skin. So you need to replace your ceramides. And CeraVe cream, which is, it comes in a big tub. It's like a big tub of it.
Well, you can pay a little extra and get the pump.
Okay, then do that.
Yeah.
You can do both.
Yeah.
Whatever you want to do. But
I like
the best.
pumps.
Okay, but that's the best one for really dry skin.
And it's what my mom was prescribed from her dermatologist when I don't know if it was cholesterol medicine, but something caused her skin to really freak out.
Right.
And then I had really dry skin occasionally, like when the weather changes, I get really dry.
Right.
And so she gave me some and I was like, this is amazing.
It's great.
And it's affordable.
It's affordable. Everybody can get it. And they have it at Costco. They have it at Walmart. They have it everywhere.
Yeah, so that's a great one. So this is from Chris because he has a selfish question he wants to ask. Having bad acne as a young person, is Accutane or a similar medication that you take orally a last option? Or if you see that the acne is so bad, you recommend something like that right away? So Chris actually had horrendous acne.
Oh, you can't even tell. You look so good now.
But
it built character, though.
Oh, yeah.
So is Accutane still a thing? Like what's...
Accutane is definitely a thing.
Okay.
Not a lot of people are comfortable prescribing Accutane because there's a lot of side effects with Accutane. So here, again, you need to see a board-certified dermatologist. These are the doctors who feel comfortable prescribing Accutane. There are a group of patients that I would feel comfortable going straight to Accutane for. And those are people that have a family history of taking Accutane, like in other words, their parents or siblings have needed Accutane, or they have scarring cystic acne immediately. Like they come in the first time, their acne is scarred. You want to just nip that in the bud. You don't have time to be trying topicals and trying over the counters. You just need to stop their scarring because it's affecting. The scars are going to be permanent unless you really have money to do a lot of lasers and stuff. And it's so devastating to their self-esteem.
And it's usually at a young age, like middle school.
Yes, middle school, high school. So I am very aggressive with severe acne, and I have no problem giving somebody Accutane if they need it right away, unless you have a history of depression. If you have a history of clinical depression, it could be worsened by Accutane. Now, we're not sure really why that happens, and it could just be because you've got bad acne, so you're depressed, and that happens,
Mm-hmm.
But if you have had suicidal ideations or been treated for clinical depression, we don't usually put you on Accutane unless we get an okay from your mental health professional.
Okay. So, yeah, because Chris is always like, just put them on Accutane. I'm like, it's a pretty intense drug.
It is an intense drug. I have a lot of patients on Accutane. A lot. At any one time, I have like dozens of people that come in here through Accutane. They take it for about 4 to 6 months, and then most of them never have acne again in their whole life, and it really changes their life.
It changes. Yeah, it changed his life.
Yeah, you just come out of your shell. Mm-hmm. Right. So it's one of the most rewarding things about being a dermatologist, actually, is being able to really cure somebody of something so afflicting.
I think not to jump on the thing, but I think we talk a lot about, just pimple here, pimple there.
Right.
I think a large portion of the people that may listen to this get overlooked and have really, really, really bad.
Yeah. And the dermatologist has the answer for you. I think you have to get past that. Dermatology is a little bit of like a glamorous profession. I mean, not me, but the specialty of dermatology. I'm like, what am I
Explanation. So Dr. Chi got a little confused
on the dates
and
showed up wearing sweats.
showed up. I'm just happy you showed up.
I was just dropping off my son, and I was wearing my sweats, gonna go to get some coffee, go to the bookstore, and then Serein was like, are you coming? I'm going, oh my gosh. Luckily I was in the neighborhood, and I just showed up, so here I am wearing my Tom's like mommy outfit,
but totally okay. We're really relaxed here.
Yeah, we are.
Yeah,
we're having fun. So yes, dermatology has this kind of aura of being maybe a little bit unapproachable or like unattainable. But, if you've got healthcare coverage, or even if you're just willing to pay out of pocket for a couple of visits, I think it's worth it to get that consultation.
Yeah.
Because your dermatologist can really guide you through something that, you don't have to suffer through that.
Yeah. And here's again one of those things, like I've been to a couple dermatologists. I've never been happy, so I never went back. But this was before I became very involved in the beauty industry.
Right.
So now I feel like I know what to look for. I know what to ask.
Yeah. Well, I think nowadays, I mean, I feel like there are so many ways to evaluate your care providers, whether it's your primary doctor, your dermatologist. There's like Yelp and there's all these websites. I mean, I would take those reviews with a grain of salt because, some people are just really upset and they want to like vent on Yelp. Okay. But that happens for restaurants too, right?
Yeah.
So you have to, I think people who read reviews should take that into account. But if you've got like 50 bad reviews, you probably shouldn't go to that person, right?
Yeah.
But if you've got like, 20 good reviews and 1 or 2 bad reviews, then that person's probably a good person to try. And we're all savvier now than we were maybe 10 years ago. So you should find the person that suits you, and not everybody fits everybody's personality.
But that's also like, I feel like growing up, like learning that it's okay to like not go back to that doctor and find a new one because sometimes personalities just don't mesh.
That's right.
Yeah.
But don't give up. If you've got a skin issue and it's really affecting your day-to-day quality of life, you owe it to yourself to, be an advocate for your own health and get out there and find the right doctor for you.
Yeah. Okay, so we only have time for one more question.
Okay.
I think this one is pretty important.
Okay.
Is there any ingredients that you should be avoiding in skincare?
I would probably avoid parabens. We don't know 100% what the damage they may cause. But we know a lot of people are allergic to them. And we know that they have an endocrine disrupting function. In other words, they simulate estrogen in your body. So we don't really want excessive hormones running around through our bodies. And so I would probably, which is spelled Phthalates, phthalates. I would also recommend that you avoid those in your like body care products, including like hand wash, body wash. I would look because you're washing your body, your whole body. If you're washing it with like a liquid cleanser, it could have phthalates in it, and that could simulate estrogens, and that's not good for men or women, and especially not kids. So maybe just bar soap. If you can't figure it out, good old fashioned bar soap doesn't have those in it.
Okay. No, that's a big thing that I've been learning too recently is why it's so bad is because of the estrogen. Right. Messing with our estrogen levels. Right. And there was a chemical SPF that's been removed from a lot of the products now that also did that.
Yes, and it's gone now, so we don't even have to worry about that anymore. But and that's one of the reasons why people don't like chemicals. But the main chemicals that are being used these days don't have that effect. And if you're concerned, just go with mineral.
Okay. So yeah, those are the questions. Thanks for sending them in. I could talk to you forever, but thank you so much for coming.
That was great. I'll come again next time. If I come again, I will definitely be on time and be dressed. I will not be wearing my PJs.
And definitely let us know if you would like to see Dr. Chi back here. And if you have any questions or want to book an appointment with her, I will have her office information.
Oh, that's nice.
Yeah, of course. Yeah. Do you have social media? Not really.
I do actually. If you want to follow me on my Facebook page, I'm just Dr. Shirley Chi, and just like and follow it. And what I do is, because I also do Channel 7 News for ABC, I will post when I'm going to be on the news, any kind of I usually comment on things that are happening in the news. If something is going on, like when the Honest Company was under fire because their SPFs were not as high as they had labeled them. I comment on, I kind of walk you through these kinds of stories. And we're going to be doing a news story. I think it's airing on Friday, which is tomorrow. So I will be, I'll just like kind of let you know, hey, 4:30, Channel 7, check it out type of thing.
Cool. We'll find your Facebook page. We'll have it linked in the show notes as well as
That'd be great.
In the YouTube description box.
Yeah, that's all I do. I'm not like a real social media savvy person, as you know.
No, but it's refreshing because all you focus on is like your patients. And
yes, I'm all about patient advocacy. So everything that I post on that Facebook page is really just for the patients. It's just like what you need to know, what I think would be interesting for you to know.
Mm-hmm. Perfect. So thank you so much for being here.
Thanks for having me.
Yeah. Bye, guys.
Bye.